Here with us to discuss Global Rare Disease Day is Dr. Fahmi Farah of Bentley Heart Center and Global Health Alliance Foundation. Welcome to the fore, Dr. Fahmi Farah. How are you?
Thank you. I'm doing well. How are you?
We're not too bad. We're not too bad.
A difficult topic, though, but something the conversation needs to get started on these rare diseases. So could you, first things first, tell us a little bit about how rare diseases are currently being represented in the medical industry as a whole?
Yes, rare diseases have different definition in different countries, which is kind of funny, because in my opinion, it should be the same definition. For example, in Europe, it's 1 in 2,000 that's considered a rare disease. In the US, it's a little bit more relaxed. So we say that 1 in 1,200, whatever disease that is, if that's the ratio, then that's considered a rare disease. There are several under the umbrella of rare diseases in every organ, so to speak. But for my purposes, me being a cardiologist, I can go into the heart conditions of rare diseases, and some of them are actually increasing here in the United States. One disease would be called peripartum cardiomyopathy. That's a type of heart failure that's unique to women. And this being a heart month, I'd like to raise some awareness on that. Pregnant women in their last trimester can get heart failure like symptoms like shortness of breath, swelling in their legs. That's actually a sign of heart failure. And often it gets missed because those are also similar signs and symptoms of pregnancy itself. It could be a very lethal disease. And with advanced maternal age, we're seeing more of that here in the United States.
Now, Dr. Farah, you have 7,000 rare diseases that impact over 300 million people globally. Give us some insights onto what they're doing to develop new treatments, because it just feels like that's like an astronomical number that will never be passed, or you'll never find time to treat everything. How are we going about that to find treatments, and how do we go about that?
A lot of times it comes down to the impact factor. As you mentioned, the number is astronomical, 7,000 different types of disease processes and across all different organ systems, and it's a global phenomenon. So to tackle it, it's a big task. So I think for the most part, at a global level, it's really determined based on the impact factor, how many people are affected, how many different regions, and raising awareness is key here. And from a heart standpoint, as I said, I'm just choosing one small disease process out of that 7,000, which is peripartum cardiomyopathy, raising awareness and letting people know about the symptoms of the different disease processes, and categorizing them and coming up with diagnostic tools, educating our providers. So it starts with our providers as well as our patients. I think being aware of how to diagnose those and how to even know what symptoms those are is where it starts.
Right. And Dr. Farah, you bring up a very, very interesting point here. How do you differentiate between a common disease that a lot of folks may experience and deal with, but then you have this different disease that is only slightly different in very small ways? How do you tell the difference between these two? Are there diagnostic tools? Are there equipment that helps medical professionals differentiate between, just kind of throwing something out there, a normal heart attack style episode, whereas the rare disease that you recently mentioned?
There are great tools available to diagnose this. A simple echocardiogram can tell us whether that person has reduction in their heart function, and that can tell us if they're experiencing peripartum cardiomyopathy or not. But to even get to that echocardiogram, we need to first be able to have that suspicion, and the primary provider, either the primary care doctor or the OB-GYN, has to recognize that this is something a little bit above just the normal pregnancy symptoms. So the threshold for suspicion has to be low. That's where we start, because it being so rare, you're right, a lot of our providers are not aware, and as a result, the prognosis can be really poor, because if it's not diagnosed in a timely manner, we can lose that patient. And I don't know if you know the numbers, but right now our maternal mortality rate has gone up. It's a worldwide phenomenon, and it's true here in the United States as well.
Wow. Dr. Farah, with it being Global Rare Disease Day, a lot of us sitting here, or someone sitting on their couch might say, well, I I can't raise awareness. How do we go about helping bring awareness to this problem in this situation?
I know I have to thank you that you're actually doing that right now by having this interview.
Right.
So people like you who have access to the media and I think education is everybody's responsibility in
Right,
any
right.
form possible. It's not possible for us as physicians to do this alone. I think as a community at a global level, we need to do this in a more unified way.
That makes sense.
Yes, 100%. I agree.
Now,
a little education goes a long way.
exactly. In regards to folks out there getting educated, where can they go for more information on rare diseases and the developments that are going along with them?
There's a lot of information online, and a lot of them are actually not in one place. So that is something we as a whole need to work on to, World Health Organization is a good place. They have some of this information there. But for heart, American Heart Association would be a good place to start. Unfortunately, it's pretty spread out at this point within the different spectrum, like, organ based. So I think we need to have a more unified, developed place where everybody can go and be referred to. We still need to work on that.
Dr. Farah, thank you so much for joining us and explaining to us and helping us raise awareness for the Global Rare Disease Day. Dr. Farah of the Bentley Heart Center and Global Health Alliance Foundation, we appreciate you, and if you need any more information on everything that we talked about here today, you can find it on the 910 News website, or we'll also have this clipped on the floor on our Facebook page. Thank you, doctor, so much for being here.